you ever heard about syphilis? Syphilis is a sexually transmitted infection that can cause serious health problems if left untreated. It is caused by this spiral-looking bacteria called Treponema pallidum. In Singapore, we are seeing an average of about 1,500 cases of newly diagnosed syphilis yearly for the past 5 years. In Europe and America, there has been an increase in the number of syphilis cases, going up by as much as 70% over the past 10 years. Syphilis is spread from person to person through sexual contact with the infected ulcers called chancres. Chancres can occur in, on, or around the penis, vagina, anus, rectum, and lips or mouth. They can spread during vagina, anal, or oral sex. Pregnant ladies with syphilis can also transmit the infection to the unborn child. You cannot get syphilis through casual contact with objects such as toilet seats, doorknobs, swimming pools, hot tubs, bathtubs. You cannot get it through sharing of clothes or utensils as well. You can start to show symptoms of syphilis 10 days to 3 months from the exposure. Syphilis referred to as the Great Pretender, as its symptoms are varied and can mimic many other diseases. The infection can be divided in a few stages: primary, secondary, latent, and tertiary syphilis.
The primary stage is the first stage of infection. In this stage, a skin pavil or skin bump will first appear and subsequently develop into ulcer or multiple ulcers that are often finless, firm, and round. This happens usually at the location where the syphilis enters the body, such as in the private areas like the vagina or the penis. These chancres usually last 3 to 6 weeks and disappear on its own whether or not you receive the treatment. And if left untreated, the disease progresses to the secondary stage within 1 to 2 months.
Secondary stage. There are few prominent signs that may occur. Firstly, would be skin changes like a rash or skin growth called condyloma lata. Secondly, patients may develop flu-like reactions. So let's talk more about skin changes. The rash. This typically rash usually appear as rough, red or reddish-brown spots or patches on the body, palms, and soles, and they usually do not itch. However, the rash may appear in various forms as well that may misdiagnose as other conditions. Secondly, condyloma lata, skin growths that can be skin-colored or grayish-white, and they are typically raised occur in moist areas like the groin, the private area, and the penis, anal area, even sometimes armpit, and the mouth. They tend to occur near to where that initial chancreas was seen, and they can be mistaken as warts in some cases. Hair loss is another common skin change. Loss of hair known as alopecia may occur on the scalp, the eyebrow, or in the bird area, and patches are widespread. The flu-like symptoms that may occur include fever, headache and body aches, lethargy and fatigue, sore throat, swollen lymph nodes, loss of appetite, and even sometimes weight loss. So as you can see, in the secondary syphilis, the skin rash may look like other skin conditions. Condyloma lata can be mistaken as viral wart, and the flu-like symptoms can be present like any other flu conditions, even COVID-19. Therefore, its infamous alias, the Great Pretender. We must always have a high index of suspicion to diagnose syphilis. Secondary syphilis will then progress to latent syphilis if no treatment is given. Latent syphilis. This stage is the hidden stage. There is no symptoms and signs, and it can last for years. However, individuals in the latent stage may still be infectious and may spread the bacteria to their sexual partners. Finally, about a third of patients with latent syphilis will progress to tertiary syphilis, where the bacteria will attack our internal organs and result in serious medical complications and even can lead to death. What is the best way to prevent syphilis?
The best way to prevent syphilis is not to have sex, but having safer sex helps reduce your risk. Using latex, condom, or dental dam every time you have sex provides a barrier against direct contact with the sore. However, sometimes sores pop up in areas that aren't covered, and contact with these sores can spread syphilis.
Limiting your sexual partners or having a mutually monogamous relationship with a sex partner who has tested negative for syphilis can help you prevent infection. This is syphilis treatment. Penicillin, preferred for all stages: early syphilis, primary, secondary, early, latent. B, Z, and PCN, L to A, single dose, IM, 2.4 million units. Do not use other injectable PCN formulations. Do not use azithromycin resistance treatment failure. In latent syphilis, you must use BCN, PCN, L to A, 1M, 2.4 million units weekly times 3 doses, a total of 7.2 million. And you can use alternatives as well, like doxycycline, ceftriaxone.